Really, the goal is just to use our stories to bring veterinary medicine to life for the pet caretakers of the world. And we're doing it because we believe that educating these caretakers is the most powerful thing that we can do to improve the life quality of all of the pets that we love. Hi, everybody. It's Dr. Natalie Keith.
Dr. Mariah Goodall.
This is Vet Tales, and we're at Northside Veterinary Hospital, Shawnee,
We sure are.
Oklahoma, again, today. So, I'm really excited to have you, Dr. Goodall, talking about our topic today.
Yeah.
This is like, you excel in this area of dentistry.
Yeah. It's definitely one of my favorite parts of medicine.
Yeah. It's something that you kind of gravitate to. I think it's because it's, at least for, the aspect of doing dentals, it's a really meticulous process. Mm-hmm. And so I think that is probably, it appeals to you.
Yeah.
But I mean, all of us are really focused on just dental health in general, which starts way before going to the dental table.
Yes, it does.
So, it's something every dog has, right?
Teeth.
Yep. Theoretically, at least at some point.
They should start with teeth.
Yeah. Well, they start without teeth, and then they get them, and then they get new ones.
Yeah.
And then hopefully they keep them, but sometimes they don't.
Sometimes they don't. Yeah.
So it applies to everybody. I think, I see a lot of the dental issues right off the bat, like during a oral exam. Owners are concerned. I feel like the number one thing they bring up is breath.
Yes, you hear that all the time. Why does his breath smell so bad?
Yeah.
What can we do about his breath?
Yeah, because that's the thing that's impacting them. Mm-hmm. That's what the owner is picking up on because it's in their face, literally.
Yes, literally in their face.
Their face, ew.
Yeah. When my husband and I first got together, he had this miniature pinscher.
Oh, yeah.
Named Jingles.
Okay.
And Jingles had atrocious breath. Mm-hmm. Like, actually, when Parker's great-grandmother would come over, she would ask that we put him up because she couldn't stand being in the same room as him.
Because he would pant and the breath.
Yes, his breath smelled so bad.
Yeah.
And this was when I was still doing vet assistant work, but took him to the doctor I worked for, and she was just getting into dentistry stuff.
Oh, yeah.
And found this massive tooth root abscess.
Yeah, that'll do it.
Then his breath smelled much better.
Yeah. Yeah. I had a Cavalier, Eliza, and she had notoriously, really difficult to maintain teeth. She was getting her teeth cleaned professionally, every 8 months. But she would, she was a panter. Mm-hmm. And so she would, in the car, stand up, on the console and, be in the air conditioner with it, in her face and panting. It was so glorious. And all of that just wafted straight upon me. So I was very aware of breath problems. Mm-hmm.
Eliza, oh my gosh.
Yeah. Yeah, so I think that's, the thing that owners notice, but then, we are looking so much deeper when the pet actually is coming into us. But owners could do some of that at home, too, I feel like. Looking at the teeth. So what are some of the things that you're looking for specifically?
So when I'm looking at teeth, I'm looking at, of course, tartar buildup. Mm-hmm. And that's pretty apparent to most everyone. If that tooth is brown or gray or even yellow. Mm-hmm. Sometimes yellow is just discoloration, but yellow can also be tartar. Mm-hmm. That's really easy, I think, in the exam room to show owners too and be like, see this brown stuff on your dog's teeth? Yeah. We need to get that off. Mm-hmm. But we're also looking at gum health.
Yep.
So if your gums are bright red right along the tooth line.
And poofy.
Or even starting to, in your boxers, overgrow, then that's telling you that you have some sort of dental disease there too. And I think a lot of people relate to gingivitis and gum health issues because a lot of us have it. Mm-hmm. And I know that I get yelled at for not flossing because my gums bleed when I go to the dentist. And it's kind of the same thing with your dogs. If you're not brushing their teeth or something at home, then you're going to have a lot of gum bleeding. Mm-hmm. But we also look at gum recession.
Yeah.
Yeah, so that's where that tartar and that bacteria has pushed the gum tissue back. And so sometimes I can show owners that.
Yeah.
Or loose teeth. That's always kind of the big, like, whoa.
Yeah.
In the exam room when you can wiggle a tooth.
Yes.
The owners are like, oh my gosh.
One of my favorite stories, I tell it all the time, but I had this old Chihuahua that came in for an exam, and the technicians had brought him back to treatment to, like, do a toenail trim or something, so I'd already kind of sneak peeked at the mouth. And we go into the room, and I'm telling the owner, I'm like, hey, I'm pretty concerned about some of Fluffy's teeth. And so and he's like, really? And I was like, yeah, let me show you. There's one in particular that I'm really concerned about. And so we get Fluffy up on the table. Just to be clear, I don't remember the dog's actual name. It wasn't Fluffy. But anyway, I lift up the dog's lip, and I'm like, it's right back. And about the time I do that, the tooth falls out of the dog and bounces across the stainless steel table and onto the floor. So I'm like, it's right about there as I point across the room. And I'm like, anyway, so we got that one real. We're like, that's no longer a huge problem. But we might have other
teeth. The rest of these.
Yeah. So wiggly teeth is a thing.
It is. Kind of fun, though.
It is kind of fun in a weird way. It really is. It's like popping pimples. For people who like to pop pimples, I feel like wiggly teeth is the same.
Yeah. You're like, it's this one right here.
Yeah,
see how it
wiggles? Or like sometimes I will push on the gum and like some purulent exudate, as commonly referred to as pus, will come out. And I apparently the technicians tell me I have a very classic sound effect that I make spontaneously when I see really bad teeth, and I don't even know if I can recreate it, but it's definitely a gasp, shriek combination, thing that happens when I see that, and I don't do it to like traumatize owners. It just literally every time gets me.
Yeah.
So
I mean, we see some pretty impressive mouths.
Yeah.
Yeah.
Sometimes I actually find myself being guilty of seeing a mouth that just has some tartar and mild gingivitis, and I'm like, hey, this is great.
Right?
Just
we've
by
got
context.
Time.
Yeah, we've got time just within the next 6 months. That's what I usually tell people at that point.
Yeah, let's handle this before it gets bad.
Yeah, before we end up wiggly and full of liquid and stuff that's gross. Yeah.
For sure. So yeah, why? I guess you want to talk about why else do we care?
Yeah.
Why do we care if all the dog's teeth are rotting, if they're just going to fall out anyway on their own?
Right.
And I think that's actually kind of one of the things I tell owners to kind of emphasize how important dental health is, because it's relevant in us too, humans too. But that bacteria, when you have gingivitis and you have those bleeding gums, that means you have open blood vessels, and then you have bacteria living in these basically like apartment complexes. That's what tartar and plaque buildup is it's little condominiums for all the bacteria. And so now you've opened up a highway right next to their condo, and they're getting in that bloodstream and traveling to the heart, they're traveling to kidneys, they're traveling to liver. They can kind of go everywhere in the body, and then once they set up there, you're going to have a hard time getting rid of it, and you're going to have disease in those organs. It's
heart disease in small breed dogs.
Classic, yeah. For your Chihuahua to come in with bad teeth, and you're like, well, let's find the heart murmur, and it's there because that bacteria will set up on the heart valves.
And some of that can be reversible. You can deal with the teeth disease, you can treat the infection systemically, but not all of that goes away. There's chronic long-term damage that happens in the heart because of that.
Yeah, you can get scarring of anywhere.
Those little valves just can't handle it.
Yep. And so then you end up with this dog who maybe would have developed heart disease, but maybe would have developed it
2 or 3 years later.
Yeah. So staying on top of their dental health is more than just their bad breath.
Yeah.
More than just their gums bleeding. It really is a whole body issue.
Yeah.
So that I think that's really important for owners to understand that I'm not vain. I'm not like, oh, your dog just
has dirty teeth. Yeah, we need a pearly white smile.
I'm really trying to protect their long-term health when we're recommending these things.
Yeah, on a preventative level before it's, damage that can't be undone. The other thing, too, that clients ask me a lot, or that I will say is that, it's painful. Not all stages of teeth disease are painful. Like tartar is not painful, but gingivitis is. Tooth root abscesses, let me tell you, I had a wisdom tooth abscess when I was in college, and that hurt worse than when I broke my wrist. Like, do not recommend. Horrible experience. Yeah. 1 out of 5 stars. So I feel for those dogs, that because it could take months to a year, maybe longer, before the tooth finally falls out of the head on its own. And every time they're trying to chew or, lick or, play, it hurts.
Yeah. I think some of the pushback I get from that is, well, he's still eating. Yeah. And I went to a CE once, and the way that they told owners, I don't think I've ever used this line, like, to an owner's face, because it seems a little abrasive, is that...
But here we go on podcast to all of you at once.
I mean, I'm not saying it about any one specific dog, but it's like the only reason your dog's going to stop eating because of dental disease is because they'd rather die than eat.
Oh, gosh.
Yeah.
That's harsh.
It is harsh.
What I say to owners all the time is, do you have any idea how bad my mouth would have to hurt before I would skip a meal over it?
Yeah.
Like, I will just find a way.
Yeah, and they do. They do find a way, but that's really the level of pain they have to be at is, like, I would rather die than experience that.
I would rather starve to death than experience the pain.
Yeah, but that doesn't mean it's not painful.
Yeah.
Because it does still hurt. Jingles, going back to my husband's min pin, when we took that bad tooth out, a couple weeks later, he was playing with a ball. And I remember Parker being like, he hasn't done that in years.
Yeah. Yes, absolutely. And cats, too. I think that's something we commonly see with cats, because they'll have really silent dental disease. And a lot of it's happening below the gum line. So you can actually look in a cat's mouth, and unless you're, trained in, root resorption, identifying that and all that stuff, they can look pretty darn normal. And they'll just won't clean themselves, and they won't play, and they'll be more reclusive, and especially in some of your more active breeds like the Bengals and stuff, when you get those fixed, you'll see them start exhibiting their original personalities again.
Yeah, I think especially in cats, a lot of people are like, oh, they're just growing up, they're maturing. This is just, part of that. And
Getting
it's like,
older.
actually, they're painful.
Yeah, for sure. Yeah, so let's just say hypothetically that we don't want those things to happen. We don't want our animal to be in pain. We don't want their breath to stink. We don't want to lose teeth. We don't want heart disease. What can we start doing right off the get-go to start putting them in a good position?
So starting with your puppies, your kittens, get them used to having their teeth brushed. Yeah. Like, if you can do that from day dot, even with their puppy teeth, they're going to lose their puppy teeth, but it's like your toddler. You're still teaching them how to take care of their teeth. So teach your young dogs how to do that. That's not going to necessarily avoid the dental table.
Just like we still go to the dentist, even though we brush our teeth hopefully twice a day for most of us.
Or 3 times.
Yeah, depending on the person. Floss compulsively. I don't know.
I hate flossing.
That's fine. I like to floss more than I like to brush.
Oh, interesting.
Yeah.
But anyway, yeah.
We're all different.
We are all different. Yeah, for sure. But teaching them, teaching your pet and getting yourself in the habit of brushing at least once a day on your pet. Ideally twice, but, I'm busy too.
Yeah. I mean, I'm going to be honest. I'm bad about that. It's hard. And on big dogs, you can get away with more. Yeah. But if you've got a little dog, you need to make this a routine.
Yeah. Know when you're getting your Yorkie or your Chihuahua that you need to commit to taking care of their oral health.
Yes. The smaller the dog, the more this is going to be an issue where you have to, be a participating factor in this pet's oral care.
Yep, for sure. If you kind of miss the boat on puppyhood and your dog does not tolerate getting their teeth brushed, there's some other options out there. Dr. Keith really likes little dental wipes.
I do.
I think they are really satisfying because you can see the gunk.
Yeah, they're just these little circles, and you just, like a Stridex pad.
Yeah, they look like a Stridex pad.
Yeah, and you wrap it around your finger, and then you just touch the dog's teeth. You just wipe it with your finger. And dogs that are really objecting to the toothbrush tolerate just your finger a lot better. So, it definitely beats a poke in the eye. And then they have things in there like the antimicrobials and enzymes to help break down the tartar buildup and stuff like that. So, yes, I could go on for days about how much I love those wipes. It's a game changer.
Yeah, they are a lot of fun. And they're effective.
Yeah.
So they're a great option too. There's lots of dental chews out there. I do caution owners on them. If you have a dog who just like rips things and then swallows it, like they're not doing any good. And if you have a dog who's prone to being overweight, then you also have to consider the calories in those chews. And then also, most dogs have a side that they prefer to chew on. And so oftentimes with these chewable things, you're not getting both sides. But again, it's better than nothing.
Yeah.
And so if that's your only option, then go for it. See how they work for you. And
the non-consumable chew toys too. There's some like that help at least for friction.
Yeah, that you like slather a little something on and then they chew. Yeah, I've seen those too. I don't have any personal experience with those. Have you ever messed with them?
It's just messy, So if you're putting the stuff on there and then they're like getting it wet and slobbery and then dropping it on your carpet, like that's amazing. So that would be my personal experience with it. But I don't really know any of my clients that have just really latched on to that. Now, some of them, like, the dogs will just like to chew on toys, and that seems to help. But a lot of times those are the bigger dogs, and they don't have as many dental issues anyway.
Yeah, more space in those mouths.
Yeah, minus the boxer.
Yeah, boxers are the exception to like every rule.
Yeah, right. Oh, gosh. I sure do love them, though.
Yeah, they're great dogs.
They are great dogs. What about the water additives? Have you...
My experience hearing clients talk about them, I actually have never used one, but my experience with that is that a lot of people don't notice a difference. You know, really, because most people who pick those up, they're trying to freshen the breath.
Yeah, like, so with Eliza, I tried it, and she just was like, this is disgusting, no.
Yeah. That's
and
what
then
I've
if
heard.
you diluted it out enough that she would drink the water, it like was ineffective at that point. So it's like water again. And so I think it would take a special dog to actually consume that. There must be dogs out there, or they wouldn't be trying to manufacture this stuff. But
yeah. So, again, it may be better than nothing. I've definitely talked to clients about it where they're like, it doesn't chew, I can't get anywhere near their mouth. And, and so it's like, well, try this and see what happens.
Yeah.
But definitely probably at the bottom of my list of recommendations.
Yeah. I just see them out there.
Yeah.
And so, if clients are seeing them out there too and wondering, like, what is this all about? It's like, you can give it a shot. It can't hurt, probably, I think.
Except maybe your pocketbook.
Yeah. It might just be wasteful. Yeah. So, and then looking at, I think if clients are going to look in the mouth at home, it's really helpful. But as far as just preventive stuff, again, I think the biggest thing is that people forget to pull that lip all the way back and look at those back teeth. They'll just lift the side up, which I can be guilty of at times too, and just assume that if the canines and those first few premolars look okay, that, like, we're fine. And that's just not true.
No. Yeah, actually, from, looking at, I don't know, thousands of dogs' mouths and cats' mouths, cats especially even, that big molar, that really big first molar that when you look in your pet's mouth, you'll see it. That tends to be the one that the tartar buildup starts on.
Yeah. And
so if you're only looking at your incisors, your canines, or even your first little premolars, you're probably missing the beginning of the tartar buildup and the dental disease in your pet's mouth. Yeah. Yeah, you really have to
It's
go
always
all the
the
way
first
back.
one to abscess, too, I feel like.
Yep.
That big old carnasal tooth.
Yeah, and in your heavy chewers, it's the most common one to break.
To fracture, yeah. For sure, look at slab fractures on them and stuff, too. So, yeah. Okay. So, yeah, which kind of, we didn't really touch on this, but, like, when the tooth itself is actually turning, because we talked about, like, tartar being brown on the tooth, but sometimes, like, canines, for example, you'll see them turn brown or gray or pink. And that's a huge problem. So if you notice, like, when you're looking in your dog's mouth and their canine looks almost translucent and pink, that's a dead tooth.
Yes, it is.
And canines do not want to fall out.
No, they will abscess up into the nose before
I love that. Good old-fashioned fistula.
Yeah.
Ugh.
Dachshunds are classic for that.
They have the worst breath, too.
They do, yeah.
Just even when their mouth is healthy, I feel like. We had a dachshund, and her breath always just stunk no matter what.
Yeah, I almost have a theory that, like, dachshunds have some sort of autoimmune ligament, like periodontal ligament disorder, because I feel like their teeth don't have to look bad.
That is,
for them to be bad.
Agree. I think, and bringing up the periodontal ligament, I think is really important because I feel like a lot of clients get frustrated because, let's say they have a dachshund or other small dog, but a lot of times dachshunds, and they've done the things, like they've cleaned their dog's teeth routinely, they've taken them in for their dentals, and yet that dog reaches the age of like 10, 12, and the teeth get wiggly anyway and start falling out, and the owners feel like really defeated. Like, what did I do wrong? Was I negligent? Did I, miss the boat somewhere? And I try to explain to them sometimes these periodontal ligaments just check out.
Yeah, they just fail. They're like, we're done.
Can you tell people what that is?
So the periodontal ligament is the little strong bit of tissue. It's really tough, but it actually connects the tooth to the socket, the tooth socket, and is what physically holds that tooth in place.
Into the jawbone, essentially.
Yep. Yeah. So that, when that fails, then that's the tooth that gets loose. That's the tooth that has a really deep periodontal pocket, which is one thing we check for.
That's the condos for the bacteria to move into.
Yeah, and that's how they move down in there and they set up shop. And
then you have infection, and then the infection further degrades the periodontal ligament, and then the wiggling progresses, and it's just a nasty cycle until the tooth gets out.
Yeah. I think it's probably a great point to point out that I get a lot of questions about, well, why can't we just do a root canal on these teeth? And it's because, unlike in humans, where our most common disease is actually rotting of the tooth itself, we get cavities, and then the cavity gets to the pulp, the center of the tooth, and so we do a root canal. Most dogs, their dental disease has to do with that periodontal ligament.
It's happening outside and around the tooth.
Yeah, and there's no way to restore that periodontal ligament once it disappears.
Yeah, the tooth bone is no longer connected to the jawbone, if we want to use the song.
Yeah.
So, and that's...
So we ultimately have to pull most of those teeth. Root canals are really only an option for those fractures that we catch before they turn into tooth root abscesses.
Which is usually going to be like on your canines and those big carnasal teeth.
Yeah.
So, okay. I have these owners that will get really distressed about the idea of extractions of teeth. And I think it is kind of like based in the fact that, like, for a human to lose a tooth, it's a very different scenario. Like, there's so many things you do before you lose a tooth, and it almost feels like this emotional, like, loss, like you're attached to your teeth. Not just physically. And so they have, like, this anxiety associated with the dog losing teeth. What do you tell your owners that are struggling with that?
I do my best, and it doesn't always work, but to reassure them that the pets don't care what their smile looks like. The pets want to eat, and once we take that painful tooth out, the things that they want to do, like eating, like playing, becomes so much easier.
Yeah, clients say that to me all the time. Well, how are they going to eat? And it's like they just don't have any trouble.
They really don't. I've done full mouth extractions on cats, so taken out every tooth out of their head, and told owners, they may go back to eating hard food, and sure enough, they come in and they're like, he wanted his kibbles.
Yeah, I've seen cats, because cats will get a really severe autoimmune disease, caudal stomatitis is what we call it, where they, the immune system is attacking all of these teeth, and the only way to stop it is to extract all the teeth, which I know sounds aggressive, and it is, but it is also the only thing you can really do in a severe case. And so these cats will come in, and they'll sit there like with their mouth kind of cocked open, and they won't swallow, and there's drool just coming down, and it's bleeding, and it's painful and swollen, and you get them, this dental procedure, and we remove all the teeth, and the next day, when they haven't eaten for days, the very next day you can put kibble and cayenne in there, and if they want kibble, they'll eat it because they already feel better.
Yeah, you've already taken
It's like
out
taking a thorn out. Is essentially what's going on, because the body has decided that the tooth is a foreign object, like a splinter, and is trying to eject it. Right.
Get out of here.
Get out of here. You are not like, it's just like when we've all had those deep splinters that like eventually pop out. It's like the same thing is happening, but for these animals' teeth. And that hurts like the dickens. Not fun.
So yeah, I mean, but yeah, those cats, it's amazing how quickly they'll turn around and go back to eating, and then their coat gets all nice and shiny again, and they fill back out, because a lot of those cats are so painful, they're not eating
or not eating well. You know, they maybe eat just half of what they should be eating, so they're not starving.
Yeah.
But then they're like, it's not worth it now. There's no place to be.
And then they fill back out, and it's really rewarding actually seeing those cats before and after.
Yeah, and they just do not care. Their gummy little smiles are perfectly fine with them. So some owners get distressed on dogs. Their tongue will start to loll out of their mouth when they lose their canines. But a lot of times, if we can do routine dental care, the canines are one of the last teeth to go. So cosmetically, that's helpful.
It is helpful.
You know?
Yeah. Because, I mean, I think the tongue lolling out of the mouth in like your little Yorkie that,
it's
someone's like
precious.
carrying it is just so cute.
I know. And they just lick and it just curls. I mean, it's adorable, but I get it. Like it does age them a bit, and that's sometimes distressing.
Yeah, I can get that.
Yeah. So, we jumped like way ahead into like extractions and full mouth extractions, but let's just say our dog has a little bit of gingivitis and some tartar, and we need a routine dental. This is like your wheelhouse. So walk us through what that looks like for you.
So, of course, we start out with all of our pre-anesthetic stuff. These kiddos are going to go under anesthesia. Dental x-rays are uncomfortable enough for me, who understands what's going on.
They do hurt a bit, yeah.
They do. Like,
biting that plate?
Bite down, and it's like, your plate's pushing into my palate. What are you doing?
It's sharp.
It is sharp.
Yeah.
So we do this under anesthesia, but what we start with on all of our patients is x-rays. So if you've been to the dentist, in your adult life, you're familiar with kind of how that goes. But we take full mouth x-rays so that we can assess under the gum line. A lot of disease will hide, and I think we've kind of touched on this a couple of times, where, on the surface it may look like some mild gingivitis, but underneath you have disease of some sort that needs to be addressed. So really important to do that.
And there's like something crazy, like 45% of the tooth or something is below the gum line. Yeah. Did I make that up, or is that right?
You're pretty close.
Yeah, something like that. I mean, obviously it depends on the tooth.
Yeah, but I mean, your canine, it's even a lot of times even more than that.
Yeah, like 65 or something.
Yeah. So there's a lot of tooth, and one thing we also have talked about in the past is when you're looking at in a pet's mouth, you're only seeing the outside of the teeth too.
Yeah. And
so while we're doing the x-rays, I'm pretty well in the mouth and looking at everything, looking at the palate, looking back at the back of the mouth. Your dentist does this too. He may not vocalize it, but
they get those little mirrors out.
Yeah, they're looking everywhere for signs of any other oral disease, melanomas.
Yeah.
Melanoma is a type of cancer. It likes to hide out in the mouth.
Or squamous cells in cats.
Cats will get, for sure, and that's a pretty gnarly, pretty aggressive type of cancer. And so that's something we're looking at while we have that mouth open, and we can see both sides of the teeth, the palate, under the tongue. We've definitely found some interesting diseases under and even in the tongue.
Yes.
Which is not...
Because you can feel the tongue as it's, they're not fighting you with it, so you can actually tell if there's like nodules under there and things like that.
Yeah.
Lymph nodes.
Lymph nodes for sure. So after we do x-rays, then we address any disease that we found. But let's say this is just a routine dental. Then we'll move on to checking pockets and cleaning. And so checking pockets, we're looking to see how much of that periodontal ligament has disease in it. And so in cats, you really shouldn't have any pockets. Their periodontal ligaments are like so firm. In dogs, you should have a little bit. That a little bit's acceptable, but a lot of times we'll find pockets that are, twice what it should be, 3 times what it should be. And so if that's isolated to just one little part of the tooth, once we get done with the cleaning, we'll use a product called Clinderol, and it's a antibiotic infused gel that kind of creates this matrix so that there's an ability,
like a seal.
For the gum tissue to kind of work its way back to the tooth.
And when you're checking these pockets, you're essentially using it's similar to the human dentistry where they're just putting that little tiny probe and it's got the little marks on it to tell you how deep you've gone.
The little pokey bit where, you know, I've had it where like there's one person doing it and then she'll stop like poking my teeth and go put some numbers in, or there's 2 people and one person's like calling out numbers as we go along. So that's basically what we're doing.
Yep.
If you have gingivitis, I don't know if anyone else has ever noticed this, but when I had really bad gingivitis because I wasn't going to the dentist often enough, whenever they did it, it would itch.
Interesting. I had really bad gingivitis when I was pregnant, which was interesting because because you just have a ton of like extra blood or something. And I do feel like it tickled.
Yeah, it felt so bizarre.
Yeah.
But anyway,
like someone like Q-tipping in your ear. But,
yeah, and you just want to like
scratch it. Yeah. No, I get that. I think that maybe that's universally true. Okay. Either that or it's just us.
Maybe.
Okay. Anyway,
we are a little odd.
That's fair. Yeah. Unique. I like to call it
there
unique.
There you go. Yes. So anyway, we would do that, and then kind of simultaneously with that, we'll scale. Which is where the tooth scraping, if you've ever had that done, or we actually use an ultrasonic, which is the one that kind of buzzes and vibrates against your tooth, which I way prefer.
Oh, 100%. Yeah, it's like, yes, as opposed to just taking something and scraping it across, this is just like vibrating it off.
Uh-huh.
Yeah.
So
it's less traumatic to me, and it's more effective.
Uh-huh. And I feel like it's easier on the gum tissue. So that's what we use to get all that tartar off. We'll get between the teeth. If we do have any pockets, we'll get down under the gum line. And then we polish, which I always, like when I was young, thought that they were just like brushing my teeth at the end.
Yeah.
But that's actually a polish, and that's to take all of the little tiny scratches that the scaler may have put on the tooth, take that off so that you have a smooth surface to prevent that tartar from building up again.
So it slides off easier.
Yep. And then at that point, that's when we would do like the Clinderol gel or whatever. And then we wake them up, and we usually want to see them back in 6 months to a year. Yeah. Typically.
Depending on the breed and age of the dog, Yeah, and I think also maybe it's worth saying, too, back to the tie in the routine dental with the extractions, those x-rays are what we are using to determine which teeth need to be removed. So I will tell owners all the time, because I don't do the dentals, I will see them in an exam, and I will look and I'll say, okay, so based off what I'm seeing on the outside, I expect this many teeth. But ultimately, when Dr. Goodall gets in there and does the x-rays, that is how we're going to determine, this tooth looked horrible on the outside, but it's actually got really good integrity and we can save it, versus this tooth looked completely normal on the outside, and it turns out there was a giant tooth root abscess that we could not see until we took the x-rays. So then, like, typically, if there is a variation from what we expected, that's when we call owners and say, hey, we found this tooth is bad, and we need to pull it, in order to not have this turn into a systemic infection in the next 3 months or whatever.
Yeah. And I've definitely been surprised on x-rays, like looking at mouths and being like, oh, this is horrible.
Yeah.
Or being like, oh, this isn't going to be too bad. And they actually have like...
Yeah, I mean, your only sure bet really is like the wiggly tooth or the translucent pink tooth. Otherwise, it's like, it's an educated guess.
Yeah.
But the x-rays are the answer for sure.
Yeah, and so, we're assessing a lot of disease on that, not just tooth root abscess, but also in cats, like absorption, resorption, and then also just like integrity of the bone underneath. Sometimes the tooth itself looks okay, but you'll have like lucency in the bone, and that's one that you get worried about.
No doubt. Those are terrifying.
They are. Yeah, we've had a few of those that have ended up being just like early signs of bone cancer.
Yeah, for sure.
So,
well, and then like back to the boxer, dealing with those epilus, and their gums are overgrowing the teeth and things like that. So those can be dealt with at the time in dental as well. So much is going on. What is it? They tell us not to call them dentals. Or what are we supposed to call them?
Oral health assessment and treatment, I think.
So I think it's obvious why we don't end up going ahead and saying that.
Comprehensive. There's comprehensive oral health assessment and treatment. It's a COHAT.
A COHAT. Honestly, that's the best they came up with.
Yep.
Okay. Well, I get, I understand why they want us to get away from saying dental, because it isn't just toothbrushing like what your groomer does. My groomer just cleaned my dog's teeth. Oh, no. That's the same thing like what you do in the morning before you go to work.
Yeah.
Is brush your teeth. This is what the dentist does, which is, a whole different ballgame. So, and because it's not just the teeth, it is all the things, the lymph nodes, the tissue, everything else that's going on in that patient's mouth, plus the blood work that's coming along with it is giving us all sorts of systemic information. So it's so much more valuable than just a teeth cleaning, which, yeah.
But it's such a mouthful.
It really is. Nobody wants to say COHAT.
And then explain what it is.
And then be like, oh, what I meant was comprehensive oral health assessment treatment something. I don't know. I think I missed the letter. But I get why they want us to do it, but just from an owner comprehension standpoint and just like the absolute displeasure of having to say it all.
Yeah.
It's not like pheochromocytoma where you feel where it's fun when you can say that and you're like, really, that's just a tumor in the adrenal gland and you sound so smart.
Yep.
No, it's not like that at all.
No, because it doesn't mean anything to someone who doesn't know what that means.
Yeah, I agree.
So you're explaining it anyway, which it's easier just to say dental. I think that has more meaning to your average owner.
Yep. Yeah. And then going through the whole, what are we actually doing? So that's what the whole point of the podcast was.
Yeah.
So cool. I think that's all I have.
Okay.
At this point I would be like, does anybody have any questions? But so if you guys have any questions,
let us know.
Yeah. Email, call, text, or comment on the actual podcast on Spotify. For sure has that if that's where you're listening. But yeah, we're here to help you understand these topics and why they matter and how to help your pet in the best way so you don't not have the information you need or want to have to make the best decisions you can.
Yep.
Okay, cool.
All right.
Okay, well, until next time then.
Yeah.
We'll see you guys around.
Bye.